because vitamin D is critically important for muscle function, which of course is important for the birthing action. And so we did a study in over 200 women at our hospital and asked the question, association with vitamin D deficiency and need for primary cesarean section. And the probability decreased by 400% just by being vitamin D sufficient at the time that they gave birth. But we're telling all pregnant women they should be on 2,000 units of vitamin D a day, along with their prenatal vitamin, and to get some sensible sun exposure. How much does a lactating woman need to put enough vitamin D in her milk to satisfy her requirement? Bruce Hollis and Carol Wagner showed 4,000 to 6,000 units a day. Indeed, pediatricians have been paranoid about vitamin D toxicity, but even the American Academy of Pediatrics recommends that all infants from the time they're born need 400 international units of vitamin D a day, especially breastfed infants. Indeed, in Canada, they recommend up to 800 units a day. For pregnant and lactating women, 2,000 units a day. 25-year-old female, poor dentition, dental caries, tooth eruption. Turns out a major problem for non-human primates. But it also turns out that one of the major Centers of Disease Control prevention report, dental caries is the most common childhood disease in America, 5 times more common than asthma. And it was demonstrated that there's an inverse relationship with maternal vitamin D status and the amount of decay in infants after they are born. Also, periodontitis is a major issue, and it turns out that a study from the National Health Survey showed the higher your vitamin D status, lower is your risk for periodontal disease. Fertile couple from Indonesia, they show up in Washington, D.C., and they had non-viable offspring. This was a major PR problem about 3 decades ago. Why? Because there were no Komodo dragons in any zoo in the United States. And Sukarno from Indonesia visited Nixon and brought a mated pair of Komodo dragons. And so they mated, and they had non-viable hatchlings. I said, well, they have a hormone problem, but not the kind you're thinking about. They're in a glass enclosure, and they cannot make any vitamin D when you're exposed to sunlight through glass. And I said, I'll bet you they're vitamin D deficient. And sure enough, when we gave mom and dad vitamin D, all of the eggs hatched the next go-around. Vitamin D deficiency is associated with low infertility, low birth weight, and poor birth outcomes.
DoctorsToTrust.com. Please share this video with loved ones.